Good morning. I'm Elisa Z. You're listening to the Sunday edition. It's the beginning of February, also Super Bowl Sunday, of course. But I didn't know until recently that February is National Gum Disease Awareness Month. And to talk about this, I'm joined on the phone this morning by Dr. Nemeth. Dr. Nemeth, good morning. Thanks for spending your morning with us. I had no idea that up to 85% of all American adults may suffer from gum disease, and the vast majority don't even know it. Is this true?
Studies have shown anywhere from 60 to 90% of adults have some form of gum disease. So 85% is a reasonable estimate. Now, some of them are very mild, some of them are very severe. But generally, gum disease is, most people, when they lose their teeth, they lose it because of gum disease, not because of cavities. The reason is people don't know they got gum disease. It's silent. It doesn't cause pain. People are unaware of it for the most part. By the time they are aware of it and there are symptoms, it is often so far advanced that nothing can be done with it, which is why most of my patients are referred by their general dentist.
Now, the fact that it is so rampantly undiagnosed, does that mean most of us are not going to the dentist twice a year?
Well, most of us are not seeing our dentist twice a year, but sometimes periodontal disease is so slowly progressive that unfortunately, very frequently, the general dentist doesn't really see the change from time to time. And even sometimes when they do, it's often far advanced. So not always does the general dentist catch it, perhaps when they should.
Well, that's a little scary to me. If even the dentists don't know, how can we be proactive?
Well, it's very difficult. I think when you go to the dentist, you should ask the dentist, how are my gums? And they should measure the gum pockets around your teeth, because as pockets develop and get deeper, that's a sign of gum disease. Also, if your gums bleed, that's a sign of gum disease. If your teeth are shifting, that's a sign of gum disease. You know, there are subtle signs of gum disease. The unfortunate part is very often there are no signs. People are not aware of it, and sometimes by the time their general dentist does make them aware of it, it's sometimes very advanced. And the real problem with gum disease is not only the tooth loss, but more and more we're finding strong associations between the infection from gum disease and these bacteria getting into the bloodstream and significantly increasing the risk of heart attack, stroke, pulmonary problems, diabetes, and even some kinds of cancer. So there's a strong link between periodontal disease, infection in the gums, and systemic diseases of various kinds. There was a doctor from Cleveland who did some research, and he said, if your mouth is not healthy, you may live actually 7 years less than if you have a healthy mouth.
That's an incredible statistic, and we all need to know the health of your mouth affects the overall health of your body.
We're finding more and more links.
So we know the symptoms are very difficult to detect early on. Once they are detected, though, what's our recourse? What kind of treatment are we looking at? And how important is it to get treated quickly?
First line of treatment is what's called scaling and root planing, which is just very deep cleaning. What happens is, as it progresses, gum pockets develop between the tooth and between the gum and the tooth, and bacteria invade these pockets, causing infection, destroying more and more bone. The pockets get deeper and deeper, and so the goal is to stop this infection and see if we can get these pockets to close. Sometimes, if that's done thoroughly and the patients are made aware of good home care, that may be all the treatment that's needed. That works perhaps in 50% of the cases. In the other half of the cases, that treatment is simply not adequate enough. The pockets are too deep, and it's not effective enough. And so for those cases, we really need to do something to more dramatically reduce that infection and those pockets. But now, with the advent of the dental laser, where there's a treatment called LANAP, we can now use the laser to invade these pockets. The laser destroys the inflamed, irritated gum tissue, selectively destroys it. It leaves the healthy gum tissue intact, and it removes the inflamed tissue, and also selectively kills the bacteria that cause gum disease. And so those bacteria, the destructive bacteria, which are dark staining bacteria, are selectively destroyed and killed. That pocket then has a chance to actually close and heal against the tooth without any cutting or invasive procedures.
This is great.
It stimulates the bone, so very often in these cases we see bone regrowing in these areas as well as the pocket closing. And it's made an enormous difference in our treatment of periodontal disease. And also, it's virtually painless.
Boy, I like that. And you said you can even go back to work the same day or the next day.
So in many cases where we can use the laser, it's made a revolutionary difference in the treatment of gum disease.
Thank goodness. This really makes it a whole lot less scary to take a look at what might be going on in our own mouths. Now, doctor, are there other people in the area doing this procedure? Are there people around the country in southeast Michigan? Where do we go to find somebody who can do this procedure, especially the laser procedure?
I was actually, believe it or not, the first periodontist and, in fact, the first dentist, Elisa, to own a laser in the United States.
The first in the country? Wow.
We now have 5 different lasers used for different purposes. Now, lasers are not always the answer. Sometimes we do need to do reshaping of the gum tissue and open up the gums because we have certain kinds of defects or problems that we have to actually visualize. But in many cases, we can use the laser, and it's made a huge difference in what we do.
Well, thank goodness I thank you for taking the time to explain a lot of this to us this morning, because you told me a lot of things I'd never heard before. And congratulations on being the first of anything is pretty darn cool, but being the first in the country, that's pretty awesome. Congratulations on that.
I'm going to tell you one more first very quickly.
Yes?
People have gum recession. That is, the gums recede, you get long in the tooth, it becomes unsightly, the teeth become sensitive. Dr. John Chow in California has developed a minimally invasive technique called a Chow pinhole gum rejuvenation technique. I was the first periodontist in the state of Michigan certified by Dr. Chow to do this technique. It's minimally invasive. Often there's no cutting involved. Often there's no stitches involved. We loosen up the gum tissue with special instruments, and we bring it down over the receded gum tissue. We reinforce it with a collagen material, and we're able then to treat gum recession, improve the appearance, eliminate the sensitivity with, again, little or no pain. So these 2 procedures have revolutionized, at least in my office, the practice of periodontics. Use of a laser to treat traditional gum disease and the pinhole gum rejuvenation technique to stop gum recession.
And you taught me where the phrase long in the tooth comes from. I never knew that before.
Yeah, as we get older, we get long in the tooth. Why is it long in the tooth? Because the gums tend to recede as we get older. And so we have a lot of patients for not only cosmetic reasons, but for reasons of health, who want this gum recession treated.
Well, Dr. Nemeth, I thank you so much for spending the time talking to us this morning and shedding some light as we enter February, National Gum Disease Awareness Month.
It's been delightful talking to you.
The pleasure has been mine. Thank you for spending your morning with us. Once again, I'm Elisa Z. You're listening to the Sunday Edition.